Thank you so much for staying with us. Now let's dive into our health topics this evening. Stress and suicide are deeply intertwined issues that profoundly impact mental health in adults. Chronic stresses such as financial difficulties, relationship problems, or work-related pressures can exacerbate feelings of hopelessness and despair, now increasing the risk of suicidal thoughts or behaviors. Joining us in studio, we're going to be talking about this to delve deeper into this topic. We are joined by Dr. Yvonne Stramiss, a Stramiss psychology practice. Thank you so much. I kind of struggled to get the surname there. My apologies. First of all, thank you so much for joining us this evening, Doctor.
I'm good. Thanks for the invitation to be here.
Absolutely. So let's talk about the common stress factors that lead to suicidal thoughts and behavior. We've of course seen some of these statistics going up at some point, but what really are some of those causes that you deal with from the patients that you've met and perhaps those that you've also noticed as a health professional? Yeah.
Okay. So suicide and suicidal thoughts come from people who feel that the world is a little bit too much for them. Sometimes it's mental health issues, sometimes it's physical health issues, but mostly it's because they are buried under everyday struggles and challenges and make them feel that there's no other way out. When we take a look at suicide, what it is, suicidal tendencies is when people have constant suicidal thought patterns. When they do have that, they sometimes feel hopeless, and most of the times when they go through that, sometimes it is mental illnesses. For instance, they suffer of depression, they suffer of anxiety, sometimes panic because of the stress that they go through. Being buried under so much stress because of responsibilities, because of things in life that need to happen and that they have to take care of, that is their responsibilities. It makes it difficult to deal with it. In saying so, we also need to understand that depression, when people go through depression, it's normally one of the things that put people in a space where they have suicidal thoughts. And depression sometimes goes unnoticed, sometimes, and untreated. And that can make the situation worse. I actually need to say also that not everybody who goes under difficult circumstances get to a point of having suicidal thoughts. So there are some of us who handle our mental health very well, who have skills to manage the daily challenges, and that can get through life without feeling suicidal.
Very well. Let's talk about chronic stress and its impact as an individual's mental health and increase the risk of suicide. Let's talk about, perhaps in your words, can you help us understand what chronic stress is and how that actually impacts someone's mental health to the point of them, sometimes even getting suicidal? Yeah.
Okay. So we all of us, we go through stress, right? Whether we wake up a little bit late, we overslept, that moment of feeling that we're going to be late at work and we're going to have problems at work, that feeling. We jump into a taxi and it takes us all over Windhoek before we come to work, and it robs you of a couple of minutes and you're in trouble. So that feeling of stress on a daily basis can become something different, because when you get to work after being late and you explain your situation, all is done. Maybe you work in the couple of hours through your lunch hour, or maybe a little bit after work. So that stress, it's good stress because it's adrenaline jumping in.
Something like good stress.
You need good stress, otherwise you won't be able to finish everything that you're supposed to do. So for you to actually get that done, the job done, you need a little bit of that adrenaline kick. So that is good stress. However, if you're constantly oversleeping and constantly late, and the taxi is driving with you all over Windhoek before getting to work, it's going to make it difficult for you, because how do you explain yourself every day knowing that you are the cause of you oversleeping and you're in trouble at work? So that long-term stress can really create mental and physical problems for you.
Very well. The reality also is that stress is always existing. Everybody goes through it. But what are some of the the things that one should do? Because we find that people handle stress differently.
Yes.
You find those that would burst out, or there were some that would sometimes even use substances to calm themselves down. What are some of the tips that you can give as a psychological expert to those who often face a lot of stressful moments, and perhaps how they can overcome those when under that situation?
Okay, looking at stress, then stress refers to a person going through difficult circumstances,
right.
A lot of pressure, and that reaction is both physically and mentally on this person under crisis, right? So each individual, each one of us, we handle stress differently.
Yeah.
I might make fun of it. You might stress about it. Your colleague might drink. The other one might use drugs.
Yeah.
It is their way of coping. So how we deal with the stress at the end of the day help us get through it. Yeah. But the accumulation of stress without the relief, without the break, without the breather, it puts us in a space where we are exposed to cortisol levels in our body that attacks our body, which make us sick. So when we're talking about sick, it comes to mentally, that you can't focus anymore. You try and keep it under by being quiet, right. But it becomes too much for you as a person. So what you do, you use now different type of coping mechanisms, and all of these things, they add up to a point where you feel hopeless. Yeah. You feel despair because nothing is changing. And then it runs into you feeling that maybe suicide might be the option for you to release yourself from everything, including physical health, financial problems, relationship issues, work problems, etc.
Well, therapy is, of course, one of the most famous, solutions to stress or mental health problems. Famously said in psychology. But how can therapy and counseling help individuals who are experiencing high levels of stress and suicidal?
Okay, so psychological interventions and therapy really assist and help symptoms of stress that leads to suicide.
Right.
The other issues that can come up because of life, daily issues of life, it also helps you to understand what it is that you go through and why you behave in such a way. What is your connection with what is happening in your life? So we have different types of behavioral therapy. The first one that I can mention that most of us mainly use is cognitive behavioral therapy, where we try and allow you to understand your harmful and negative behavior and how that connects to the emotions and the feelings that you have. Then we have psychodynamic therapy. So psychodynamic therapy is for you to understand why you're suicidal. So we try there and delve in and try and understand what is the connection with your past behavior, your present behavior, and the emotions that you have, because there's always a connection. Then we have the normal pharmacology, where you can get medication to help you through that. And of course, we have coping techniques as well to support everything that I just mentioned, mindfulness and meditation. So mindfulness helps you to understand and for you to be present and aware about what you go through and your feelings, your emotions. And then sorry, looking at your face when you said yes.
I feel like I'm getting a free therapy session right now. That's why I'm also reacting to everything that you're saying.
And then meditation allows us to be clear in our minds, to understand why we feel the way we do feel. Apology on that one.
No problem. There's so many things, especially societal pressure and expectations, and how much the role that they also play in relationships between stress and suicide. How do you deal with that as a psychological expert, and what is your advice that you provide to your clients?
For better or for worse, we get messages from our world around us. And what is this world? It's family, it's friends, it's culture, it's your social circle. It comes from all of that. So at the end of the day, it impacts our decision-making skills and the way we do it.
Yeah.
Why? Because we want to be part of that. We want to be part of family, of friends, your social circle. You want to be part of all that. So, and I think the biggest thing is we want to fit in. When we want to fit in, sometimes we allow ourselves good things, because social pressure is the messages that we get. It doesn't mean it's always bad. So if you are a hardworking person and I'm hooking into you and your circle and good things come from there, you're pushing me, you know, to be self-sufficient with my skills that I have as a person instead of just a job, having a side hustle. I can hook into that and it's good for me. But on the other hand, it can also be bad because now I have people that does things differently than what I do. It's against my value system, yet I want to be part of that. I want to be fitting in. And then it takes me to a point of risky behaviors, negative behaviors that can put me again in harm's way.
Very well. So for what signs can, you know, friends and family look out for when to identify a loved one who's going through stress, especially when it's, you know, leading to suicidal thoughts? What are some of the signs that one should look out for?
Okay. What you need to understand is suicide or suicidal ideation is not a mental illness. It's a consequence of what you are going through. Okay. So for us to actually understand that is the accumulation of stress, accumulation of stress, and there's no break, there's no relief, right? And you still need to deal with it day after day after day. So at the end of the day, you have people that you are living with and they can pick up on some of the things that you do. The person that you used to be and the person that you have become. Yeah. So most of the times is you becoming very quiet, you are withdrawn, you either sleep a lot or you don't sleep. Sometimes it's the changes that they see, especially in your behavior and your demeanor. And sometimes the way you take care of yourself, your hygiene. Sometimes it's the dangerous behaviors that you have. Fast driving, doing funny stunts, playing with knives, taking
risks.
Risky behaviors that can also cause that. And sometimes we need to, as family, as friends, as personal people to them, we need to be able to pick those up. Sometimes it can be recent trauma or severe illness that can also put people also in that. And when people talk about suicide, they don't want to die. They want to die. They don't want to be alive anymore. They want to go somewhere. They want to go home. Where's home? You are home, but you want to go home. Where is it? For you to pick up on that, to be supportive.
Very well. Dr. Stramiss, thank you so much for making the time to talk to us today. And thank you so much for the tips personally, first of all. And thank you so much for helping our nation understand this very, very, very stressful issue. And of course, hoping that they've learned something from this.
Okay, hopefully you learned also something.
Absolutely, indeed. For free. Dr. Yvonne Stramiss from Stramiss Psychology was, of course, talking to us about stress and suicide, the causes around that, and, of course, how you can, of course, detect the signs of your loved one, and, of course, the tips that you can, of course, also take upon yourself to avoid, bursting out, and also the things that can lead to suicidal thoughts. That also wraps up today.